Well, the doctor is in on a rising number of plague cases in this country. Health officials say there have been 13 cases and 3 deaths over the last 5 months. These cases, as you can see in the map, really impact residents across the U.S. in 7 states, most along the West Coast and the Midwest, although you see Georgia there. Dr. Rosie Chauhan is joining us with more on this. Dr. Chauhan, what do we hear a headline plague. How dangerous is the plague
I
today?
think when you hear the word plague, your mind goes back to the 13th century.
Absolutely.
Black Death,
right,
where 50 million people died in Europe because of that infection. I mean, now we have antibiotics, so that does change the trajectory of this illness.
But still, this is quite a bit more of cases than normally, isn't it?
Yeah, normally in the US is about 3 a year. And the transmission is basically by rodent bites and the fleas that feed on them.
Oh.
So there are some preventative measures that you can take by using insect repellents and wearing long pants. And, you know, obviously the people who are more susceptible are going to be outdoorsy, kind of outgoing people.
Well, those are our type of people. We like to see families get out and enjoy the great outdoors, although I know some of the cases have been in some campsite areas. Yes. But just basic insect repellent, you should be pretty much protected from this?
Well, not quite, because, you know, the rodent bites
of course
wouldn't be prevented with the insect repellent, but, you know, the fleas that cause it.
Now, how do doctors know if you actually got the plague? Because it's so rare, and let's say this was transmitted. I mean, obviously you would know if an animal bit you, but if it was an insect, like a mosquito bite, you might not even know that you had it. So
what's the history?
How do they connect the dots?
What's the history? So if you know that you've been outdoors, I suppose it's the same with Lyme's disease. If you've been out and about and you come back with a huge rash, you may be at risk. But with the plague, you might have a fever and you might have a lymph node enlargement. And so in that situation, you go to your doctor and tell them the history of any kind of outdoorsy activities.
Interesting. So we're going to watch that again. It's in a few states, but because of the title and because it's kind of odd, we wanted to make sure that we covered it. Also because of the back to school time, we saw this new study that's revealing that siblings are the most common source of whooping coughs in infants. A study in pediatrics revealing 36% of infants develop the infection from their brothers and sisters, and that is a change from previous years, which cited mothers as the usual source. This is something we've been watching because we've seen the outbreaks happen when it comes to whooping cough at an alarming rate. And this is interesting. So brothers and sisters are the ones that are really impacting the younger ones and their families. So how do families make sure that that doesn't happen?
Well, first of all, the incidence of siblings causing the transmission have increased because of waning immunity, that the current kind of with the vaccination that's been used in the last 20 or so years doesn't have a long enough protective effect, although it is good in the short term. And so that leaves people over the age of 11 susceptible to this infection. So the problem is that infants in the first 2 months of life don't have any kind of protection because they have no functioning immune system that's going to protect them. So the point is, if you have somebody who's infectious or even semi-infectious or with waning immunity, and they can pass on that to their little brother or sister who's only 2 months old. And the way to get around that really has been suggested by the CDC, that everyone get booster shots, that the older siblings get booster shots, and even the mother in every pregnancy, because, you know, these antibodies don't last forever, in every pregnancy should receive a booster of something called Tdap, whereas the actual vaccination is called
So
D-Tap.
good to ask about that, especially if you're around, even if you're a grandparent around a baby. Just if you haven't had your booster, it's a good idea just to check that one off for your family. Dr. Chauhan, great to have you. Thank you very much.